Hello, and thank you for joining us for Together San Diego. I'm Paola Hernandez Jayo from the San Diego Union-Tribune. This winter season, healthcare providers are seeing an increase in the triple-demic surge. This is leading to healthcare worker burnout and a term called compassion fatigue. Our guest today is Dr. William Mobley, Distinguished Professor of Neurosciences and Interim Institute Director at UC San Diego Sanford Institute for Empathy and Compassion. The doctor is going to share with us the work the Institute is doing to help combat healthcare worker burnout and create a kinder, more compassionate healthcare system and also world. Hello, Dr. Mobley. Thank you very much for joining us today.
My pleasure to be with you. Thank you very much for having me on. It's a very important topic that we'll discuss, and I'm very glad that you chose to make this available to your listeners.
Yes, tell us, Doctor, what the Institute does, when it got started, and also what it means to be an Institute for Empathy and Compassion.
Yeah, the work started, the Institute was formally launched in 2019. It really is the product of a number of years of close discussions with our donor, Denny Sanford, and the understanding that empathy and compassion are at the very core of what a doctor needs to be an effective physician. And Denny was especially interested in the empathy and compassion training for our medical students. And so that's a huge focus for us. But quite frankly, all of our colleagues, students, residents, fellows, and faculty are an important focus for us in terms of understanding how do we help them support their empathy and compassion. How do we make it possible for them to be most effective in their patient care responsibilities? And quite frankly, in partnering with one another to maintain their wellness, their sense of wellness and well-being. We have 6 centers. Those centers are, 2 or 3 of those centers are focused on medical student education and empathy and compassion. Another one more focused on physician communication skills. One on empathy and social justice and human health. And then finally, there's a research center that is extremely involved in funding research proposals that go all the way from the basic science of empathy and compassion as expressed in the brain and to its application societally in society in general, but especially in the healthcare setting.
There is a lot of research that is also being done through your institute for this situation. Tell us what compassion fatigue is. A lot of us may understand the term burnout, but what is compassion fatigue in particular when it comes to the healthcare industry?
Right. So let me take apart empathy and compassion and then compassion fatigue. Empathy is the ability and willingness to feel with another, to be in a space with another, to walk in their shoes and to share their emotional issues, concerns, state of being. Compassion is the ability to understand the burden that this places on that person and to be willing to share that burden with them. Compassionate action is actually reaching out and helping people in distress. Compassion fatigue is when someone is simply unable any longer to engage in empathy, to take on the burden of another compassionately, and to reach out effectively. It's a product of people being under great distress for one reason or another, and simply being unable to focus on the other as a target of empathy and compassion.
Wonderful. One of the things you were also talking about earlier, Doctor, is about how the Institute is starting to work with helping doctors early on when they start in medical school, because that is also a very stressful time. But it's a time when doctors and even students at that time can learn to be mindful. Tell us about these efforts.
Yeah, it's exactly right to say this is the beginning of your life as a doctor. And one brings to medical school all kinds of terrifically talented young people, and almost all of them would see themselves as fundamentally empathic and compassionate. But they will soon enter a domain in which those are challenged by just the workload, the intensity of the effort, the mountain of evidence, of information to climb. And so we need to help them sustain themselves. We need to help them focus on themselves, understand that their importance as human beings, and through mindfulness meditation to basically be able to see themselves more realistically in their own lives and in the healthcare setting, to put aside the worries of every day to the extent that one can, to focus on one's own well-being, and then to be able to reach out and help others with their well-being. Our brains are constantly in worrying mode. We constantly think about all the things we need to do and the things we need to get done yesterday, and it plagues us, it concerns us, it depresses us. Mindfulness meditation is one way to calm the mind, to still the mind, to center the mind, and help the mind to be much more effective than in seeing what really is important around us and how we ought to behave and help others.
This is very interesting and can also be applied to many of us out in society in multiple professions, including, being a parent, a stay-at-home parent, taking care of elder parents as well. And as you said, it's true. We're constantly in a state of worrying and thinking about the multiple things that all of us need to do. So I cannot even begin to imagine the stress that some of these doctors and healthcare workers are currently facing. Something that the Institute also offers, Doctor, is free learning modules for healthcare workers. For those folks that are watching us today, our audience, that are not healthcare workers, can they pass on this information, and where can the information be found, both for healthcare workers and if somebody wants to pass on the information to somebody, a family member or a friend that they may know that is a healthcare worker?
Yeah, if they can go to empathyandcompassion.ucsd.edu, and we're very eager for people to come to the website and take advantage of all the offerings we have there. We're really proud of the fact that during the early days of COVID, we put on a number of meditations every day, 5 days a week, sometimes on Saturday. We had a great number of people attend those sessions. The feedback from those sessions was that people felt much better, much more socially connected. And we actually measured the effect of those meditations and found that they reduced stress and anxiety and depression. So please do come to the website. Please do take advantage of our offerings. Whether you're a healthcare professional or not, we want you to come and be part of that, because quite frankly, all of us, every one of us, needs to live a life of empathy and compassion. We need to be there to feel with others, to care for others. And so whether you're a doctor or a nurse or in any other profession, please come to the website and take advantage of what we have to offer there.
Thank you very much, Doctor. I am sharing that website online, empathyandcompassion.ucsd.edu. Just listening to you right now, Doctor, your voice, your tone, the way that you're presenting is calming me during this interview. So I can just see right now how effective this may be. I'm also going to share the phone number where the public may call should they have questions, 858-534-2230. And on social media, you can find the UC San Diego Sanford Institute for Empathy and Compassion at UCSD Compassion on multiple social media. Something else that you'd like to add, Doctor?
Well, I just want everybody who is a patient needs a doctor who really cares for them, who understands them and listens to them and really acts compassionately toward them. Please understand, physician burnout is a real problem. It's a product of working too hard, not being listened to effectively, spending too many hours on the computer with the electronic health record. Understand that your physicians are under a lot of stress. And when you see them, just be who you are. Understand that they're people too, and that while they're caring for you, do your best to care for them in turn. They'll appreciate it very much.
That's wonderful. Great feedback on what we can do as patients also to help our own healthcare workers. Thank you very much, Doctor. And thank you all for watching today. If you would like more information, you can go to empathyandcompassion.ucsd.edu. And as Dr. Mobley indicated, there's free learning modules for healthcare workers there. I'd also like to thank Angela on your team, Doctor, for helping us to put this interview together. Thank you all for watching today. If you would like to find more, if you would like to watch more of these Together San Diego interviews, you can go to San Diego Union-Tribune.com/Together SD Live. Doctor, thank you very much. I think for the rest of the day, you've made me be more mindful of what I'm doing throughout my day. Thank you very much, Doctor.
My pleasure.
Yes, and thank you very much all for watching today. We'll see you next time. Have a great day.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, you're telling us that you believe in what we do.